which is open to the press and the public. The meeting is being broadcast live, and a recording of the meeting will be made available as soon as possible after the meeting has concluded. We welcome the use of Welsh language at meetings, but I've had no request for people to speak in Welsh today, therefore the meeting will be conducted in English only. Please can members refrain from using the chat function and instead use the raise hand icon to indicate when you want to speak. Can I also remind you that as per statutory guidance made under Section 4 of the Local Government Wales Measure 2011 and our formally adopted hybrid meeting policy, any member attending a meeting remotely must be able to be seen and heard by members and officers who are attending the meeting, as well as by the members of the public who are viewing the meeting. So can I ask that you all please use your cameras for the duration of this meeting. Please remember to keep your microphones muted when you're not talking, and please do not interrupt discussions until you've been notified of your intention to speak and you've been invited to do so. We now move on to our agenda. Jay, do we have any apologies, please?
Thanks, Chair. We have apologies from Councillor Tew and Councillor Price.
Do we have any declarations of interest?
No problem. If I just go through the list of members and we'll go through them. Bear with me a sec.
Move on to agenda item 3, the minutes of the meeting of the 18th of April 2024. Members, could you state whether you have anything to raise in relation to the minutes? If not, I will take them as agreed. Agreed? Agreed. Also, the minutes of the 18th of July 2024. Could you again state if you have anything to raise in relation to those minutes? If not, I will again take them as read. Agreed? Oh, thank you. Agenda item 5, the action sheet. There are no actions outstanding on the action sheet, so we move straight ahead to agenda item 6. Okay. Before we move into discussions, I would like to welcome Jacqueline and Claire from our Family and Children's Services. I'd also like to take the opportunity to thank Julian Devine, the Place Service Manager, for his very detailed briefing note and for meeting us last week to discuss the Place Service provision for our disabled children, and to remind members of his offer of visiting the Place Service provision for disabled children during the half-term half-break. I'm now going to hand you over to Jacqueline, who is going to give us a brief report before we commence our questioning. Jacqueline.
Thank you. Thank you. The report aims to set out how we're ensuring we deliver an effective and robust service provision for disabled children within the borough, obviously focusing on the services that we deliver within children and family services. You will see from the report that we've very much based our baseline around the last inspection of disabled children's services within Torfaen, which was dating back to 2020. There were a number of positive outcomes from that inspection in 2020, but also a number of areas for improvement and barriers to progression that were identified by Care Inspectorate Wales at the time. And what we've aimed to do throughout this report is to, I suppose, highlight where we have managed to make progress and also areas where progress has perhaps been not as good as we would anticipate. I think you'll probably note, I know we came to scrutiny previously in relation to the rapid review of child protection, and I think from my perspective there are some themes that are cross-cutting between the rapid review of child protection, which was obviously considering the whole population of our children and was a national review, and the CIW inspection for disabled children in 2020. So notably, I would say, in relation to advocacy for disabled children, that was highlighted by CIW and was also highlighted as part of the rapid review. And also children's attendance at meetings, again, was highlighted by the rapid review and highlighted by CIW in relation to disabled children. And obviously, there are different considerations in relation to advocacy and attending meetings for disabled children than there are for the general population, but nonetheless, it's really important that we do what we can to ensure that their voice is heard across the service and within meetings that concern them. So we've also set out within the report our legislative duties in relation to disabled children specifically. Members will note that there is a statutory duty on us to assess where there is a request in relation to a disabled child. So there's an assumption within legislation that a disabled child will require support above and beyond that which can be provided by their parents or carers. Just to highlight, I don't intend to go through the report verbatim, but obviously we've talked in there about the services that we provide directly, how we set out to undertake assessments, etc. We've also got there the referral sources. I think what's interesting for me is the low number of self-referrals for disabled children, and I think I would expect that to be higher. You know, parents and carers themselves seeking support. The other thing to note in 4.14, where we've got the children looked after, the disabled children who are looked after, and just to provide members with an update since this report was written. So you'll note within that pie chart that at the time of this report we had 2 disabled children who were in placements that are operated without registration. So essentially, obviously, we never want to be in a position where we've got children in unregulated placements, but I suppose even more concerning to have disabled children in placements that aren't registered. So since this report was written, I can confirm that we now have no children in unregulated placements. Those 2 children have both moved on. One is now in an independent fostering agency placement, and the other is in a residential placement, but a registered residential placement. So from my perspective, that's really reassuring that we've managed to move those children on. The report also sets out some of the various tools that the team use to communicate with children and young people. And we then go on to talk about some of our commissioning arrangements, safeguarding in relation to disabled children. I know this was one of the areas that was highlighted within the Care Inspectorate Wales report, specifically around concerns in relation to the timescales for initiating initial child protection conferences, but also statutory visits not being within timescales, and hopefully members will see that that's vastly improved since the inspection in 2020, which is again positive. And we also talk about transitions, which is an area that was highlighted, and that has very much improved. Continuing care is an ongoing issue and point of discussion between Children's Social Services and the Health Board. And then finally, we talk about the Register of Disabled Children, which has now been implemented since the inspection, however, disappointingly not utilised. And I think there's a real opportunity for us if we're able to get improved use of that Register of Disabled Children in terms of planning and developing services to meet the needs of children, but would also give us a good idea of those children who are ultimately going to become adults, so that there would be an impact in terms of adult services as well. The team sought some views from disabled children themselves and parents, carers recently, and that's been included in an appendix for members to consider. There's also financial information set out in the report in terms of the services that are delivered. We obviously we've excluded staffing costs from that. And then we've set out the actions that we intend to take following scrutiny, but they will also obviously take into consideration any points that members have today. And I think that concludes my summary of the report. Thank you.
If everyone's happy, we'll start our questioning. And the first question comes from Councillor Colette Thomas. Colette.
Thank you, Chair. The disabled team is supported by an occupational therapist who is located within an adult service team. Does the shared capacity support from an OT officer? Has it got sufficient capacity?
I'm sorry, can you ask? I'm wearing hearing aids, and this isn't a great for me to hear. It's a huge echo, so...
It's about the disabled team is supported by an occupational therapist who is located in the adult services. Yeah. Does the shared capacity support from an OT officer? Is that sufficient?
I would say that it is sufficient. However, there is still, thank you very much, there is still a waiting list. So you'll see that there's a 4 to 6 month wait in respect of assessments. However, if we look at how that compares to previous, that's a significant reduction from where we were previously. So in an ideal world, we'd have our own and we'd be assessing straight away, but we don't have that luxury. But currently, it appears to be working as effectively as it has for some considerable time. Does that answer your question?
So the average rate for an assessment would be between 4 to 6 months?
But, sorry, do you want to...
That's the Disabled Facilities Grant, isn't it?
Oh, I'm
the
sorry.
4 to 6 month wait.
To access that. I can't tell you what the wait is, I'm afraid, but I can find that out for you before the end of the meeting. Apologies. Is there any chance, Councillor, that I can have the questions, because I'm really struggling to hear? Apologies. Sorry.
Okay. Anybody else want to come in? Any supplementaries on Colette's question? Okay. The next question comes from myself and is in relation to 4.3. 4.3 of the report sets out a number of staffing changes, including senior positions. How have these changes bedded in? Is it difficult to recruit and retain social workers with experience of working with children with disabilities?
I think recruitment and retention of social workers, as members will be aware, is really tricky anyway, and particularly recruiting experienced social workers, it can be problematic. And I think what we've seen where we've managed to recruit social workers more recently, they do tend to be newly qualified social workers. There's some real value and benefits in recruiting newly qualified social workers. They come with a fresh pair of eyes, new ideas, obviously up to date in terms of knowledge straight from university, but it also means that we need to put a great deal of support around them. Members will note from the report that the last time that we went out for a social work post within the disabled children's team, that we didn't manage to recruit a social worker into that position. And as a result of that, we made the decision to amend that post to a further community support worker post in the team. What I would say for the disabled children's team, you'll see from the workload and caseload data, we don't currently have any disabled children in that team who are on the Child Protection Register, which obviously requires a qualified social worker, and we have quite a small number of looked after children within the disabled children team. They also require a qualified social worker. For those who are subject to a care and support plan Part 4, the legislation doesn't require them to be allocated a social worker. A community support worker can work with them. Obviously, those community support workers are managed and supervised by qualified social workers. So I think the makeup of the workload in the team lends itself to the team having community support workers as well as social workers.
Thank you. Do we still carry the bursary for help with training social workers? We brought that in quite a few years ago and supported them through their training. And
yeah, so we put two employees through the social work traineeship per year. And there's always a high level of interest in that.
Thanks, Jackie. And before we move on, John, do you want to come in? No. Okay, we move on to question 4, which again comes from, I beg your pardon, question 3 is going to be taken by Councillor Williams.
Thanks very much. You've actually partly answered this question, so thanks very much. It's looking a little bit at the recruitment of the community support workers, so useful to understand that they've got that sort of cohort of children that don't have particular needs. So, but would that be, how would you monitor that to make sure that the balance of caseloads, you know, say if there became more children who needed social work input rather than a CCW, would that be sort of monitored?
Yeah, absolutely. I mean, as you'll see, it's a relatively small team. So in terms of management capacity within that team, it's quite healthy. And that means that the manager and assistant team manager are obviously able to have really good oversight of the children that we're working with in the team. So obviously, if there came a time where we were starting to see the numbers of children on the child protection register or looked after significantly increasing to a point that we didn't have sufficient social work capacity, obviously we'd need to consider the makeup of the team at that point.
Which is from Councillor Colette Thomas.
The average caseload in the team is 21.4. It must be considered, however, that the role of workers within this team differs significantly from that of the locality teams due to the specialist support required by disabled children. Should the caseload be lowered for social workers in the disabled children's team? And is time allocated recorded in order to make a more detailed comparison?
I think in relation to caseloads in the disabled children's team, I think there are two things for me that are really important to consider. Number one is that generally within the disabled children's team, that caseload of 20 will be 20 individual children from 20 families. Whereas within the locality teams, you might have large sibling groups, so you might have a caseload of 20, but that's made up of 8 to 9 families, for example. So I think that's one real thing that we need to consider when we're monitoring caseloads. But on the flip side of that, what I would say is that members will also note there's a large proportion of children open to the disabled children's team who are in receipt of direct payments, and that might be the only service that's being provided. So actually, in terms of then the capacity of the individual, whether that's a community support worker or social worker manager in that case, that's going to be far less intensive and time-consuming than working with a child on the child protection register or looked after. So I think, I don't know whether that answers your question, Councillor.
Okay, we've gone to question 5, which comes from Councillor Thomas. Councillor David Thomas.
Thank you, Chair. In 4.10, it sets out the action taken in response to a referral. So it's got close-up proportionate assessment information provided, close-up proportionate assessment signposted to other agencies, and close-up proportionate assessment, no clear and support needs to be met. Could these have been dealt with at first stage, removing the need for the progression?
I think that's quite a difficult question to answer generally, but what I would say is that sometimes the information that we receive at point of referral will be more detailed than at other times. So it may well be that we receive a referral, and in order to conclude that there are no care needs to be met, we need to make further inquiries in order to establish that. Sometimes we'll get the referral in, it'll be incredibly detailed and comprehensive, and we're able to make a decision straight away based on that information. So I appreciate that that's quite a general answer, but yeah.
Okay, anybody else wants to come in? Okay, thanks, Jackie. Move on to question 6 from Councillor Jane Watkins.
Thank you. In 4.13, it says that of the 84 active cases, 16 are children who are looked after. Do we experience challenges placing children with suitably experienced placements or placements that are adequately equipped for the children?
I think members will know from previous scrutiny meetings that we've attended that placement sufficiency is an issue across the board. That can become more complex as the needs of the children are more complex. So I think the direct answer to your question would be yes, it is more difficult. But having said that, there are some really highly skilled foster carers out there who are able to meet the needs of disabled children. So, yeah, it is a struggle, but we have got some good placements out there for our disabled children.
Can I just ask, so if you had foster carers or people who were interested in foster caring, particularly with disabled children, but didn't feel they had the equipment or the experience and knowledge, do we offer training in that, or will you only take them once they are experienced?
So foster carers don't get approved specifically to care for a disabled child, but obviously if there were carers who were interested in caring for disabled children, then we would provide them with the support and training necessary to upskill them to do that, absolutely.
Move on now to question 7, which you've already answered. Thank you very much. That's one that you answered previously. So we've gone to question 8, which again, and question 9, which comes from Councillor Jane Watkins.
Thank you. So moving on to 4.23, it says, unfortunately, the mentor scheme was not sustained. Do we think that it will be coming back? And if not, why not?
Is that working now? Yeah. So, in relation to the mentor scheme, this relates to our collaborative communication training that we rolled out in 2021. And one of the key messages that we had from other local authorities who had implemented strengths-based approaches, models within their local authorities was that the really important thing is your ability to sustain that going forward. I think there are a number of local authorities who've probably invested quite significantly in training staff in a particular model or approach. You then have a turnover of staff, and then you either don't have the finances to bring trainers back in to train the new staff, etc., and then it's not sustained. So we were really live to that issue at the time, and we created a post within Children's Services specifically focused around the strengths-based model and ensuring that that was sustained and embedded. One of the things that we didn't account for was that that person would ultimately retire. But as part of the collaborative communication training, we set up a mentor scheme. Unfortunately, what happened, I think that there's lots of lessons for us in terms of how we did it, but a number of the individuals who were identified as mentors moved on. We then lost the individual who was in that post overseeing them, and there was a gap between recruiting somebody else. So we didn't make the progress that we'd intended to make. We now have Georgina Ermston in post. She's the Service Development Team Manager, and is very much part of her role to take this forward. Georgina has been liaising, working with Social Care Wales in relation to this, and has also visited a number of other local authorities who have the model and approach well embedded within their service areas to try and learn from others really in terms of how we can best implement that. So we've got some really good ideas now from other local authorities and from Social Care Wales. Myself and Georgina over the last few months have been going around all the teams within the service area, across the service area, to understand what works for them in terms of the strengths-based approach, how they've embedded it in the team, what the barriers have been to not embedding it if they haven't, and also seek an interest for mentors to join that mentor scheme. We're really keen to ensure that we have a number of individuals from each team who are identified as mentors, so that we don't fall into the same trap that we have now. And what we've said is that there'll be an expectation that they pass the baton on if they leave. So as part of their notice period, one of the tasks that they will need to do is identify another person in the team who will pick up that role as mentor before they leave. And hopefully then we will have that sustainable model in place.
That's really good to hear that. So, Kay, do you want to come in?
Okay, thank you. I think that the mentor was just one aspect of strengths-based practice and the collaborative communication, but from a strategic perspective, we're also looking at different processes and procedures that will ensure that we're embedding this from, I don't like the term top-down, but if you're going to role model and guide your staff, you have to be promoting that from a senior perspective. So we are looking at, quick wins in respect of how we can ensure that that is embedded within the service, because it's a whole culture change. A collaborative approach requires social workers building positive, trusting relationships with families. That takes time. So it's about us managing capacity within the teams. It's about us embedding that strengths-based culture within the teams. It's ensuring all of our processes are ensuring that strengths-based practice is coming through. So there's lots of things that we're doing in order to promote that collaborative communication, which generally means strengths-based and outcome-focused. Our paperwork, for example, we're ensuring that our paperwork has specific sections that social workers have to complete where we ask for personal outcomes. And then we're working very closely with our IROs, our independent reviewing officers, to ensure that when they're undertaking those reviews, they're ensuring that those personal outcomes are listed and that those quality relationships are being developed to ensure that that approach is being embedded throughout the service.
I've got a quick sort of supplementary. This will bring confidence in families, because sometimes when you're providing care with social workers, you have a change in social worker that unsettles everybody. So I see this as a way forward, a continuation of, ongoing process. So it was good. Rose.
On that point, I just wondered whether or not there's succession planning built into the whole development of your staff. Actually, if somebody wanted to reduce their hours or increase their hours or know that they're going to retire, is that built into your staffing structure?
It is, but I think with the recruitment and retention issues, in all honesty, that makes it really difficult. I think, we're required to give 3 months' notice of leaving. That seems like quite a significant period of time. Back in the day, it used to be a month. It's now 3 months. You think that's plenty of time to get somebody new in. It's really not. And because generally, wherever that individual is coming from, they'll also have to give 3 months' notice. There quite often will be a gap between one person leaving and another person joining, which is really difficult to manage, both for the team in terms of workload, but also for how that's experienced by the children and their families.
And very often you get a number of staff who will of that age that they're retiring at the same time, and that can be a big blockage, can't it, when you're recruiting new staff into that.
What's this one? Thank you. Sorry, it's helping me with the microphone.
Sorry, that's no problem. Jane, I think you've got the next question.
I wanted to come in.
Apologies. I just wanted to make those links really in respect of retention. Recruitment and retention is another priority point for us, within children and families. And, there's a number of regional and Wales-wide aspects that are supporting us with that to try and avoid the recruitment of agency staff, which means that we're holding on to our own improved supervision and support for our staff, managing our caseloads effectively. You've seen that, we monitor that on at least a monthly basis to ensure that we're supporting staff, work-life balance, etc. So there's lots of different aspects that we're looking to cover to hope to retain our staff, so that we work with a collaborative approach and everything else that comes alongside that.
Do we have agency staff at all? No?
We do currently have some agency staff, but I believe that it's at reduced level to what it has been. Is that correct?
We've currently got 5 agency staff across the whole service area. We don't have any agency social workers within the disabled children's team specifically.
Anybody else want to come in?
Yeah, so just going back to what you were saying about the 3-month notice period and sometimes the issues that can give you with recruitment. So does the same apply then to, if you've got the 3-month notice period, for putting another mentor in place, or is that long enough to identify another mentor and get them ready to take over?
We don't know yet because we haven't experienced it. However, what I would say is I would hope that 3 months is sufficient time if somebody knows that that's priority before they leave to pass the baton on, and obviously the team managers will be aware. I'm hoping that that will be a far more effective way of sustaining it going forward.
Jane, I think you've got the next question as well, please.
I do, thank you. Okay, so 4.27, it says there, management's ability to monitor improvements is problematic as there is currently no data recording process for carers assessment and restrictions on amendment to the current database. Managers are working in partnership with the performance team to develop processes as required. Could you let us know how many separate carers assessments are being done at the moment? And when is it anticipated that the new processes will be developed and implemented?
Carers assessments aren't being completed separately at the moment. They continue to be completed as part of the assessment for the child. I think I'm correct in saying that.
We have undertaken some carers assessments, but that's specifically for access to grants. So the Bridging the Gap grant relies on a carers assessment to access that grant. And so we've increased our carers assessments in line with accessing that grant and developing that respite service alongside Cranbridge School, the after-school club. So we've managed that. What I will say is through conversations with my staff, the carers assessment is often seen as a duplication of assessment. The assessment of disabled children is generally seen as a holistic assessment that looks at carers' needs alongside the child's needs, and we develop a care plan to meet that family's needs. So when we're asking for carers' assessments to be undertaken, I'm being advised that's almost a duplication. What I've done is I've looked at legislation and good practice guidance, which suggests that if consent is provided by the carer and the child where appropriate, the carer's assessment can be incorporated into the child's assessment. So what we're looking at is whether we're able to do that with the current database and ensuring that there are specific sections that detail that that's actually happening. So not just a tick box to say we're doing the carer's assessment, but a specific area where we look at the carer's personal outcomes and the needs, which will then we'll kill 2 birds with 1 stone, if you like then. We'll evidence that we're undertaking those carers' assessments in line with the needs of the child, and we'll also have a data collection system that will allow us to manage that also. There is, if consent isn't required, then of course we'll complete the carers' assessment alongside.
Just want to come in for the next question?
I do.
Colette? Jane?
Do you have a potential timeline for that, for how long that might take before you can say, yes, it's working to do it like that, and we're sure we're getting all the right information for the family?
From my perspective, I'd like to say tomorrow, but I am reliant on the data team. Those inquiries have already been made, but it will result in the form having to be rebuilt, and I couldn't give you timescales in respect of that. But I can assure you that it's something that we're going to be monitoring and pushing forward as soon as possible.
That's lovely, thank you.
I was just going to add to that. I think from my perspective, one of the things that we do need to ensure if we are sticking with a combined assessment then, I'm really conscious that this was an area that was highlighted by Care Inspectorate Wales when they completed their inspection. And we were saying, yes, we complete it as part of the child's assessment. And what Care Inspectorate Wales was saying is, we've looked at your assessments and we don't think you are. So from my perspective, if we are going to complete that as part of the carers assessment, as part of the child assessment, as managers, we need to ensure that we're regularly monitoring that to ensure that it's not just individuals avoiding having to complete a separate assessment, and that assessment truly reflects both the needs of the child and the needs of the carer and the outcomes that come from that.
So does that mean that you or your team will be involved in the planning of the form then? Because obviously you want that form to give you the information you need as well as the information they need.
Absolutely clear will be involved in the development of that form.
And I also ask if carers will be involved in the development of the form, what they think you should know.
So currently within our disabled children's team, you'll see from the feedback forms, we have really positive relationships with our families, with our children and families. So it would be important that we ensured that the form was. So I would be proposing that we probably have a trial form that we would use initially before it's secured to ensure that it's meeting everyone's needs.
Next question comes from Councillor Colette Thomas.
Torrine Play Service provides children community play opportunities for disabled children and young people aged 15 to 18 years. 5 to 18 years. What about what early years provision is there for children aged 0 to 5 early years?
More limited support available currently for those children 0 to 5 years. But what we're seeing in response to that is that we're having more applications for direct payments so that families can manage their own care and identify their own personal assistance. But it's something that we're currently looking at because as part of an audit of direct payments, that's something that's been highlighted as an additional need. So it'll be something that we'll be looking at more closely, and I'm more happy to feedback where we come with that.
We also have support for disabled children that's delivered via the early years team now. I'm sure members will be aware as part of the ending of the previous contract that we had in place for short breaks. That's now been brought in-house and is managed via the play service and the early years team. So they're picking up that. I can't give you full details of that now, but if members want further information in relation to what that looks like, we can certainly provide that.
Do families who require equipment for children have access to a family fund?
There's lots of access to grants. So the Disabled Facilities Grant, you'll see the Bridging the Gap grant that's listed there. Is a huge amount of access to different charities. If we felt that a child, that we couldn't access that, then it would be something that we would be considering or working as a team with health to develop those. Health in general meet a lot of those specific needs. But we have lots of access to different grants, and we're signposting families and supporting the application for that.
Okay, next question comes from Councillor Jane Watkins.
Question 11.
Question.
That's okay, thank you. 4.3 refers to short breaks for families with disabled children, and it says, unfortunately, this continues to be an area for development, with there being limited opportunities available for parents, carers, to access overnight respite or short breaks. So we wondered what the challenges were in delivering this. Are they financial, location, suitable provision? What's preventing that from happening?
I think it's linked to the general issue of placement sufficiency. I think what complicates it more in relation to short breaks is similar to respite care for the general children looked after population, that if you have a foster carer, for example, who is approved to care on a full-time basis then, for want of a better word, their spaces, their vacancies are going to be taken up very quickly by a child who needs a full-time placement, which then means that they're not available to provide any respite. And there are a very small number of individuals who will come forward simply to provide respite. And when individuals do come forward to provide just respite, they will be very quickly linked up with a child or young person who requires regular respite, which then means that they're not available for any other children. So it's a general placement sufficiency issue.
Do we know what other authorities are doing? So I sort of assume that they must have similar issues. Do we know if they're doing anything differently that we could use?
I think some local authorities have got residential respite models, and I think before my time in Torfaen, I think we had sort of collaborated with Monmouthshire, I believe it was, in relation to their provision for disabled children, but that came to an end. So I think it will vary. Some local authorities have better provision in place than others. I think it would be difficult for us from a financial perspective to set up a residential provision purely for overnight short breaks for disabled children, because there wouldn't be the numbers that would justify setting up that provision. So yeah, I think it's a real struggle.
Question 12, Councillor Seaborn.
Thank you, Chair. My question relates to 4.31 and 4.32 in the report. And this service currently supports 160 young carers under the age of 18. Are we confident that we have identified all our young carers? And do we monitor the take-up of provision for young carers set out in 4.32 and assess whether the provision is what they want, and how do we ensure a smooth transition between age categories? So you mentioned transition earlier on, but...
In relation to the identification of young carers, I think we're as confident as we can be that we are managing to identify young carers. I know that Torfaen is quite proud of our use of the Young Carers ID card scheme, and we have a number of young carers who come forward specifically requesting that ID card. So I think we're as confident as we can be that the awareness is out there in terms of the services available for young carers. In relation to monitoring the provision and the take-up of that, I'm sure it's done, but I don't have that information available to me today. But again, we can certainly provide that if that's something that members would be interested in receiving.
Lucy, do you want to come in?
Just in relation to identifying young carers, I'd be interested to know, do you have like sort of a connection with our local schools? Because that's often the first point of contact where you'll pick up young carers. So I just wondered if there was that kind of information flow between yourselves and the education department.
Yes, absolutely. And members will be aware now that with children's services being in the same department as education, I think that's helped massively. We obviously have a joint leadership meeting between children's services and education where any issues like this are regularly discussed. And in fact, the Young Carers ID card scheme was recently a topic of discussion within that meeting in terms of ensuring that schools are recognising the Young Carers ID scheme within individual schools.
Okay. Come in first.
Thank you. I think you'll see from the report that the plan for us is to bring the Young Carers project into the disabled children's team. I think that will support us in identifying those young carers of disabled children, and it will then give me oversight of how we're currently managing things, because I can't answer any questions currently because I don't oversee that area. But I'm hoping that you know, when it comes into the disabled children's team, we'll be doing a review of how we're managing it. And
we've had some concerns given to us from young carers, actually, and And one of the concerns is that the staff within the schools do not understand, all staff. It might be that the head teacher knows that they're a young carer, but if they're late for a class, and it's because they've cared for their young brother, or their young brother wouldn't leave, wouldn't calm down before they left, then that staff is not aware of that situation. How can we filter that information down into schools? That, it might be that it's just form managers that need that information, but the young carers themselves identify that this can be a problem if they're late in school. Or
that was the exact issue that we discussed in the leadership meeting, and talked about the I can't think of the name of the forum, forgive me, but we talked about raising it within the youth forum, so that perhaps the ambassadors could ensure that that was raised within the schools as well, because we have been made aware, not specifically in relation to Torvine children, although it was fed back via our young carers social worker, that there were some issues where schools weren't perhaps recognising the use of the young carers ID card, because they felt that they had other systems in place for vulnerable learners more generally. But I think the young carers, what they're saying is actually, no, I want to be recognised as a young carer. That's important to me and my identity. So it's definitely something that we've been discussed, and something we've discussed and are aware of, and have plans in place to try and resolve that.
Please.
Yes, thank you. Just two sort of practical questions, really. So looking at 4.32, that list of provision for young carers, the first one is the fortnightly groups for the under 10s. Is there a minimum age? Because it just sort of says under 10. Is there a minimum age that they can start using that? And the other question is, if needed, do we provide transport for the young carers to get to this provision?
I don't know, I'm afraid, is the honest answer, but I can certainly find out for you. I'll make note of those and find out and report back.
Can I come in quickly? Are disabled children eligible for, blue badges? Yeah. Yeah, that's okay. Thank you. Go on to next question, which comes from you again, Jane.
It is, yes, thank you. On 4.33, it says practitioners also signpost families for funding assistance from the Honeypot Children's Charity. Are there any stipulations as to what that funding can be used for?
I'm sorry, I don't know, but I can find that out. I don't have that detail, but I can find out for you.
Okay, anything else? Jane, you've got the next question, question 14.
Thank you. Moving on to 4.35, it says in Torvine there are difficulties in parents recruiting skilled personal assistants. Do we know why it's difficult for parents to recruit personal assistants, and what are we doing to support parents in overcoming this?
One of the biggest challenges that we're encountering currently in respect of personal assistance for disabled children is the level of needs and the risks associated with that. But we're working very closely with our health colleagues to look at how we can manage that more effectively. There are some queries around commissioning and liability, but we're looking, whilst we can't joint commission currently, is something that we're looking at for the future, health and social care potentially having that pot that they can joint commission from. That's going to be some way off. So we're looking at an alternative, a memorandum of understanding potentially, where we include health professionals in supporting families with training, risk assessments, regular monitoring, having that 24/7 helpline that they're able to call. The other difficulty is just finding individuals who are willing to take on the task. It's quite tricky because you have to have someone who's willing to commit week on week to provide that service. But we are supporting parents as best we can. I've seen recently, not with our local authority, but with other local authorities, there's social media posts promoting personal assistance and the benefits that come with that, and it's something that we could that we're looking at to see if it's a potential to support us also. We're also working very closely with the independent living team to make sure that the process of employing personal assistants is as straightforward as it can be, because it can feel a little bit of a minefield, particularly when you're talking about employing someone and parents taking on that role. So we're supporting with that also as best we can.
Anybody else? We now from Councillor Seaborn.
Thank you. And this question relates to 4.35 in the report. Where available, families are presented with other options for support alongside direct payments. How many families are in receipt of direct payments? And can you provide examples of other options that are available?
Okay, so I would suggest, I think we currently have 56 families receiving direct payments in the local authority, and their care plans quite often include an array of other services. So Torvine Play, TOGS. Generally, the direct payments are to provide a level of respite care for families. So we ensure that the care plan that's developed provides the necessary respite that's needed. So, for example, if Torvine Play isn't an option for the young person because, I'll give you an example, there's a young person who struggles to stay at the Torvine Play for more than an hour and a half. They become quite distracted after that and dysregulated. So in that case, a direct payment is more appropriate because a personal advisor can take the young person out to an activity that they're interested in. It can be a longer period of respite care, because what we hear from families is an hour and a half. By the time you drop the child off at play and get home, you're on your way to collect them again, and so it doesn't provide that sufficient level of time for them to undertake their activities or just to recharge their batteries. So this is where we try and be creative in how we manage those care needs, and it could be that direct payments meets all of those needs, or it could be that the child needs some social aspect, which would be Torvine Play, and then they need some time in the community to develop confidence in the community. That can be met by a direct payment. So it's about creative care planning.
Anybody else? Okay. The next question.
Yeah. Question 16 you've already answered, which was about the Memorandum of Understanding. Question 17 is about 4.37. TCBC should ensure information on services are promoted, up to date and available to disabled people in a range of formats. Can I ask how we are ensuring our services are promoted in a range of accessible formats, including different languages?
So we don't have any Welsh speakers in the disabled children's team currently, but we do have that support within the local authority. For a lot of our disabled children, you'll see within the report there may be communication problems or difficulties, I should say, which means that our assessment or building those relationships with the family and with the child can be more problematic, quite difficult. But you've seen within the report some of the efforts that we make to manage that. So one of my social workers sent out photographs to the child so that mum could prepare that via a storyboard to say this is who's arriving, this is what she's likely to do to reduce the levels of anxiety. Sometimes we attend schools and we'll just spend time within the school, not with that specific child, but just so that the face is a recognisable face. We also work really closely with Crownbridge School and other specialist units to understand the child's communication needs. You'll see that within the report we talk about a communication passport. Now, that's just basically a document that advises professionals working with a child how best to communicate with that child. It might be that you speak very slowly. It might be that you communicate via pictures. It might be that you need an advocate alongside you to support that. But each child has an individual need. And prior to us jumping in and undertaking that assessment, we'll ensure that we understand really clearly what that need is. Before we move forward, you'll see all the different ranges of services that we use with the PECs, and they sound quite complicated, but actually with a little bit of assistance from a teaching assistant or or a member of teaching staff, we can generally work with the child.
Supplementary, I was just meaning Welsh. I was meaning possibly Ukrainian or other languages. And quite a few years ago, we did a big a piece of work on the leaflets that are put in doctor surgeries and making sure that there were other languages available. And we learned a lot from Newport, which has quite a diverse population. And I just wondered, obviously this day and age, we've got apps that you can put on your phone, but I just wondered how we were dealing with different languages.
When we generally use a translator. So I think that it's really important that when we're communicating with families that we're doing it appropriately. And whilst in some situations, you know, in your social life, you might be able to use an app or rely on a neighbour or someone to assist you. When you're working with children, very vulnerable children, or in cases of perhaps child protection, etc., we have to be sure that we're commissioning services that we can fully rely upon to translate our messages clearly to the children and for them to translate back to us so that we can manage that effectively. Not easy because we are fully reliant on others, and sometimes it can take a number of days to access the right person for the role, and particularly with disabled children. And I'm just making assumptions here, but when we talk about the needs of disabled children and how long it can take for us to communicate with children who speak English, is likely to be a longer process for disabled children, but I haven't experienced that to date.
Next question comes from Councillor Colette Thomas.
My question is, what are the current waiting times for CAMS, please?
I can't give you a waiting time, I'm afraid. They're not overnight. there are some, in some cases, there are some significant wait times. But what I can say is that it's dependent on the needs of the child. So if we do have children in crisis, we would generally have a same-day service, as in a same-day assessment. But I couldn't give you those figures, I'm afraid, but I can ask for information if necessary. What I can say is that we're developing our relationships with CAMS and COLDS, with some of our young people with high-level needs. And the success of one of our disabled children in being rehabilitated home, I would say, is in part to the positive working relationship that we had with health services and the support that we had for that specific young person in developing a sound understanding of their needs, etc. So we had health come in just to supervise our care staff, to explain to our care staff the best way to respond to behaviours, to understand needs, and that proved vital in supporting that young person to progress. And we've seen a massive change in the level of risk, in the level of need. And as I said, the young person, after being accommodated for quite a significant time, is now living at home very safely. And that's down to effective multi-agency working with those services.
That's really good. Anybody else want to go? Lucy, did you want to go? No. We're going to question 19, which comes from Councillor Seaborn.
Thank you again, Chair. This relates to 438, and it's about the Disabled Facilities Grant. So, my question is the grant funding combined between adults and children's services, or do you have a separate pot? Is all the available funding allocated by the end of the year, or do we have leftovers and vehemence?
Don't know, I'm afraid.
An issue again was that at the end of the year, the Disabled Facility Grant pot wasn't used, and therefore it went off into somewhere else when it was in environmental health and what have you. And I just wondered whether or not we'd got control of that DFG pot, and you know, it's actually being used for the purpose that is put it there for, rather than leaving it unused and veering it off somewhere.
It doesn't sit within my area of responsibility, but it's a very good question, and it's something that I would be interested to understand as well. I'll make some inquiries.
The other thing, sorry, Chair, just to come in on that point, I know members will note from the Care Inspectorate Wales inspection from 2020 that our use of disabled facilities grants for children is very low. So, yeah.
Okay. Next question comes from Councillor Jane Hopkins.
Thank you. Referring to 4.49, it says in the past 12 months, 2 referrals for active offers of advocacy for the children subject to child protection intervention have been made, and 10 issue-based for advocacy referrals for disabled children. Would we hope to see more referrals for advocacy, and how will we strive to achieve this? How do we discuss advocacy in appropriate ways with younger children? I know this committee in the past has had conversations about advocacy. One of the issues that we raised was like the word advocacy to children, understand that. So as part of that question, the videos and leaflets that are produced for you, do we know if they use other terms or explain it well, or do they just use advocacy?
So I manage the NIAS contract, and so when the figures that you see here are specifically for NIAS, National Youth Advocacy Service, what I will say for disabled children is that the skills of the advocates within NIAS are more limited than the skills of other less formal advocates, if you like. So with disabled children, advocacy can mean support from a teaching assistant or a person that you have a trusting relationship with, support from a family member, support from a youth worker or a play worker. So advocacy as we see it for perhaps other children isn't as effective for disabled children because of their communication needs. And as I said bringing in a stranger to have conversations with a child who's very vulnerable can be quite difficult. The 2 active offers sit in line with our responsibility under child protection. So any child that is progressing to initial child protection conference must have a referral for advocacy made. But in the main, in respect of disabled children, I would say that advocacy comes from someone close to home who they trust and have that supportive relationship with.
Can I ask Lucy? Sorry, it's slightly more of a comment than a question, but it's interesting that the CRW inspection was very much focuses on legislation, so like 2 formal referrals, but what it doesn't pick up, which you've highlighted, is that advocacy itself is a very broad way of communicating. In fact, and I think this should be highlighted in inspections, that the formal methods of communication are just as effective and just as important. Sorry, the informal, probably more important than the formal, but I guess the formal ones can be more easily recorded. But in fact, from what you're saying, it's those building up relationships, which by their very nature include advocacy, which need to be highlighted.
Definitely what we're intending to do, or I think that I spoke to you previously in the Child Protection Rapid Review, is about enhancing the voice of the child and encouraging their attendance at meetings, their engagements with assessment, and that's something that we're looking at, and I've undertaken some research in respect of advocacy and supporting young people in that way. And what we see is that the word advocacy is generally seen in that formal sense, a referral, and we're supporting children to understand that, you know, if they require support or someone to help them to attend a meeting or to share their wishes and feelings, that's how we manage it. So we're sort of not stepping away from the advocacy, but we're explaining it to a child in a different way. And in respect of the leaflets and the videos that are sent out, they're quite impressive actually. I don't know if you've seen them, but they're very child focused. So they will talk very much about an adult listening and conveying your views, your wishes, your feelings. So I think, you know, I'm quite pleased with the quality of them, and I'm working very closely with NIAS now to ensure that, you know, the recordings of the services that they are provided, that we have really close oversight of that and ensure that it is working effectively for us. So the time frames, etc., you know, what are the barriers to achieving those advocacy time frames, and we're working very closely together to manage that.
I think there's a general consensus, isn't it, that some information is not an easy read for people.
It's really not, and if you think of, you know, just from a layperson's perspective, you're going to a child protection conference and your family's, all of your family's most private and personal information is going to be shared. Do you necessarily want to sit with a stranger and have those conversations, or would you prefer to sit alongside your teacher who knows you well and who will understand you? And I think that's where we're at. So we recognise the legislative requirements for us, but we're also looking at what's in the best interest of the child and how we can more effectively support them to have the support that they need.
That's clear.
I was just going to say I absolutely agree with the point that you're making in relation to informal versus formal advocacy, but I do think that we need to be very careful when we're talking about advocacy in relation to safeguarding, because depending on who that individual is and what their links may be to kind of potential perpetrators, for example, I think that's why there is such a focus in terms of independent advocacy in relation to safeguarding referrals, particularly if you think about perhaps disabled children who have difficulty communicating, that it would be very easy for somebody to portray a particular view that wasn't necessarily the voice of the child. So I just think, yeah, we need to be careful about that.
Just reassurance that that would happen as part of your an assessment. Thank you, Jacqueline, for bringing that up. It wouldn't be appropriate for us to ask a family member to provide information in respect of an assessment around safeguarding. We would be very clear around it being an appropriate person and evidencing that rationale within our assessments.
Yeah, so having listened to all that, no, I totally take on board what you're saying about the safeguarding thing. But with the more informal, would then the CIW be happy with it being done in a more informal way? Or are they expecting to see it done in a more formal way?
The active offer for advocacy is a duty, is a requirement. We have to do that. So we couldn't say, well, we're not doing that. We're taking an informal approach instead. Having said that, I think if it was clearly evident from the case file and from discussions with professionals, etc., when CIW were coming in to do their inspection, that they could see that the voice of the child was being heard, whether that's directly from the child, whether it's via the social worker, whoever it comes from. I think the issue is that we need to ensure that the voice of the child is heard. So I think CIW, I don't know because I haven't asked them the question, but my assumption would be that what they're looking for is that we are hearing the voice of the child, and that's clearly evidence within recordings.
Okay.
Thank you. So 4.52 says Torvine Children and Family Services are actively promoting practitioner awareness of independent advocacy services through providing bite-sized training. And what are the take-up levels for the bite-sized training?
Okay, I can answer that because I manage Georgina, who manages the bite-sized training. So bite-sized training doesn't just cover advocacy, it covers lots of different areas. So for example, this week we were talking about the voice of the child and attendance at meetings. Attendance of practitioners can vary, but what we've intended to do is the bite size is that they're small, short sessions where we provide information and then provide additional research that you can go away and read afterwards if necessary. But because they're over lunchtime and they're between 45 minutes and an hour, attendance is pretty good. So I did the last bite-sized training, we had 42 attend. So, you know, it does vary, but, you know, we're proactive in encouraging attendance, and because it's such a short, you know, we're also rolling it out to our education colleagues as well, so where we have a session that might interest our colleagues. So young carers, we had the young carers social worker do a bite-sized session, and we rolled out that to our education colleagues so that they can understand some of the additional needs. So it's working it is working well currently, and we hope to record the sessions, although we're not doing that successfully currently. We were hoping that we could record the sessions so we can send them out to staff so they can use them in their own time. But that's something for the future. We haven't got there just yet.
Okay, thank you.
I just ask
Yeah, of course.
on non-verbal, how you would get the non-verbal disabled child? The non-verbal children. Apologies. The non-verbal children. I just wondered how we communicated with those. Obviously, we can't hear their voice, and how we listen to them.
So that would be via our specialist systems and their communication passport.
Oh,
So, you know, some children will tell us with pictures what they want. Sometimes it's gestures. Sometimes teaching staff who work with these children day in, day out very clearly understand what they're asking for. So sometimes we're quite reliant on our colleagues to support us with that. But in general, the practitioners within the team hope to spend enough time with the child to build that relationship so they'll be able to communicate independently with them. Sometimes it's easier than others, though.
Thomas.
Yeah, thanks, Chair. The bite-sized training, where do you do the bite-sized training? And would you online? Would you do them in schools? Would that be an idea?
I think that what we're looking at, we're struggling currently with face-to-face, and that's because of people's capacity. So we're working quite closely in the leadership meetings that we have currently around how we can increase teachers and teaching staff attendance on these sessions and ensure that we're working together to upskill staff and to share information. We're currently planning a joint information sharing session. We've been working very closely with our education colleagues to see how can we manage this, and what we're hearing from them is lunchtimes are not good. Yeah. You know, we provide lunchtime bite-sized training because it works for us in social care, but actually teaching staff, that's the only downtime that they get. So they're asking us to provide later in the day, 4 o'clock onwards. So that's something that we're taking on board. And for the next session that we're providing, not the bite-size, but the information sharing session, we're putting 2 sessions at 4 o'clock, 2 sessions lunchtime. But we've used this now to support us in understanding that perhaps the low take-up from education is because it's lunchtime. And we've learned that perhaps we should have asked first before we made an assumption that lunchtime is going to work for everyone. So, yeah, we hope to make some changes there as well, and perhaps roll out a double session when it comes to that information that's going to work for teaching staff and education also.
Might well be a thought to include it in governor training. You know, so that's part of that session, and they know it's there, and they can pick and choose to come.
I have, thank you. Yeah, so 4.56 says that Torvine Disabled Children's Team developed a process in collaboration with Adult Services and Education, talking about the transition. So how well equipped are teachers to raise awareness of transition support?
So currently, I would say that transition for children who have active cases to the Disabled Children's Team are managed really well. So we've got a transition worker who sits in adults, and they're made aware of children from the age of 14 in supporting that transition through to adult services and adulthood. What we recognised is that we were losing those children who didn't have active cases to disabled children. So adult services were quite often having referrals when families were in positions of crisis because of changes in support available, changes in benefits and entitlement, etc. So this is where we've worked alongside adult services and education to develop a new process, which is very early days. It's not actively working currently, but we're almost there, I would say, where families are encouraged to speak to teaching staff, or if teaching staff identify that there may be some additional support needs for the child and the family, they can refer through, and we'll manage that process separately. So the transition worker will still be involved, and adult services will be notified, and will either signpost to appropriate services or will refer through to adults if necessary. Not all adults require an active case to our adult services, they just need support in that preparation.
I was just going to add to that I think this is where the Register of Disabled Children would be really key as well, because obviously then individuals would be voluntarily providing that information, contact details, etc., what their needs are. So actually, from our perspective, in terms of being able to have that oversight of the disabled children who are in the borough, obviously those disabled children are going to become adults, so we would have all that information. So I think that's something that I'm really keen that we develop, because I think we're really missing a trick in terms of not having managed to get that up and running effectively.
I've got question 23. Sorry. Oh, sorry, Jane.
It's okay. So two questions, because you're sort of on two different points there. So do you have a timeline for when you expect this to come into place? And am I right in understanding, so you're going to be informing the families and the teaching staff? So sort of a double way of doing it.
We're working in collaboration with education currently. So we're speaking to them about the best way that we can do this. This started a few months back, where we just threw around some ideas about how we could manage that effectively. And adult services are taking sorry, I'm losing my train of thought. Are taking the lead in respect of this, but alongside education. So when I say that it's not up and running, that awareness is already there. We're already raising that awareness. But in respect of formal processes, we just have to tweak a few things, and I can feed back. I haven't got the update information of where we are currently because I haven't attended the last few meetings, but I can get that information for you and sort of give you an idea of what that process looks like currently.
Yeah, that would be very useful. Thank you. Question 23. Trumine has a dedicated continuing care lead. How effective is this?
Effective. How's it working? Okay. So we have a continuing care lead whose role is currently to identify those children throughout the region. So whilst Andrea is a Torfaen employee, she covers all of Gwent. So she works with Newport, Monmouthshire, Blaenau Gwent. Her role to date has been identifying or supporting local authorities to identify those children who may be eligible for continuing care, and making those applications with them, so supporting those applications. She also attends the peer review groups, so she sits with health, and where necessary will challenge decision-making around eligibility. She's very knowledgeable in legislation, case law, etc., that would support us in accessing that. One of the most important roles I would say that she's done recently is that she's rolled out training to all staff, so about raising awareness of continuing care funding and how to access that. And so now we're seeing more timely applications being made, and we're also developing more effective working relationships with health and identifying those children that are eligible for continuing care, but also identifying those gaps. So continuing care are for those children who have really significant levels of needs that can't be met with statutory services or specialist services. That's only generally a handful of children within a region. But what about those children who fall underneath that level and the statutory services are not quite the suit? So we're looking at those gaps as well, and how we can start to plug those gaps as a multidisciplinary team to ensure that families and children are supported as effectively as possible.
Thank you, Chair. I was just going to raise that one of the, I suppose, frustrations from our perspective is around the timeliness of those decisions being made. So just to give an example, if we've got a child with complex care needs who requires a move of placement, for example, and that's into a residential, we have to make those decisions within the timescales for the child. We can't delay making that decision in order for the funding panel via continuing care to make a decision as to whether they will contribute to it or not. So I think that's one of the tensions really, is in ensuring that we can have those discussions with health. And when I say with health, with somebody who's able to commit to those funding decisions, because quite often we're able to have those conversations on a multidisciplinary basis with health colleagues, but it might not be somebody who's able to commit to joint funding of that placement. So then we're on the back foot in terms of trying to get that money back retrospectively, which I think is a bit of a tension, yeah.
So, in your opinion, that's a major gap in provision for services. Okay, that's lovely. Thank you.
Lucy? Yeah, sorry, just trying to understand that a bit more, because that's always been a huge problem with continuing healthcare, isn't it? The funding. So from what you're saying, the delay comes from that funding panel, which is a health. So is that something that would need to be addressed at a, I don't like to say it, but like a sort of higher level? Because that's quite impactful, isn't it? If you're not getting, if the child's identified, you've got timescales, but the NHS protocol, which is not quick, is kind of like stopping that. So it sounds like it needs a bit more pressure from on high, if I dare say that.
We are certainly having those conversations, but haven't managed to find a solution yet. There's also a dispute panel in relation to continuing care applications, and that's a regional panel. All the heads of service sit on that, and senior members of the health board sit on that panel as well.
Certainly not really effective, is it? Jay, Rose, I think you want to come in.
Just one point. It shouldn't be a timely matter, because we know when that child is transitioning, don't we? And we know when that child is in need. So, especially if it's come from a younger age, something, you know, urgent or emergency is a different matter. But if that child is coming through a terminal illness, and we know when the need is going to be there, surely that can be planned for rather than retrospective claiming back of money owed.
I think it depends what it is. In the case of a placement move, for example, you might have a child who has been confirmed as being eligible for continuing care funding, but the contribution that health make will be based on the care package that that child is receiving at the time. If you're then changing that care package, they will then need to reconsider what their funding contribution will be towards that, and I think that's what then causes the delay.
Can I just say that I just wanted to reassure you that whilst there is that delay from health in respect of their funding, we don't let that impact on the children and their families. There will always be a case where that child's need will be met and it will be funded through social care, and then we will make efforts to reclaim that money. The children are never delayed as a result of that panel.
Good assurance. We're moving on now to question 24, which comes from Councillor Jean.
Thank you. Going back to the register that you raised on a previous question. So it does say in Torfaen there are only 2 children registered, which evidences the requirement of a formal review of the system. So when will this review be progressed? And we did wonder why, when the CIW require this, and it's a legislative requirement, is the registration then voluntary? We felt that those two things didn't really go together.
So with the legislative requirement, I couldn't get that word out then, is for us to have a register. You can't compel somebody to disclose personal information about themselves. So whilst we're required to have that provision available, children and families aren't mandated to provide us with that information. I think what we haven't done well is promoted that, the awareness of it, both within service, across the council, across wider organisations. For me, we've missed a huge trick in terms of how we could really be promoting this. In terms of the benefits for the family, that actually, you know, if we have that information, we're able to ensure that we plan and deliver services effectively to meet the needs of the children who we know are in our area.
Okay.
Well, I'm taking control of this. So in respect of when the review will be undertaken, it's already started. So I've already met with our colleagues in our comms team and our commissioning team to look at why we're at this point when it was a requirement. And I think what's become apparent is that nobody's actually taken responsibility for the register. So it was proposed that it sit with social care, and then there was discussions had around the appropriateness of this. But I've confirmed with Jacqueline that we will take responsibility for the disabled persons register, disabled children's register, and we will progress it. The two children that are currently registered, we've also looked at how they became registered. So how the two children or two families know about this and nobody else does. And it appears that it was by accident. So they've looked to access something else on the website, and they've become a parent of the Disabled Children's Register and registered as a result of that. But what we are going to do is, like I said, we're going to take responsibility of it in the Disabled Children's team, and I'm going to work with our comms team and ensure that it's promoted effectively, and with education, because I think that's our key in for those children, but also in ensuring that we also evidence the benefits of registration and how that will support the local authority in identifying service or measuring service provision throughout, but also in supporting those children through transition, etc. So as Jacqueline said, I think that it's going to help the local authority as well as those children that be registered, and I'm hopeful that within a fairly short period of time we'll have it up and running and we'll see some quite significant changes.
Okay, yeah, no, that's good to hear, because obviously it's causing issues in the department with planning and progress of things. Yeah, so no, I think that would be very beneficial.
It probably causes issues with funding as well. If they're not registered, or they might slip through the loop if they're not aware of the services that are available, then funding doesn't follow them in.
Yeah, agreed. I think it's everything that we do here is based on evidence, and if we've got that evidence that there's service needs, then funding should follow that.
Okay. Councillor Seaborn, I think you've got to question 25.
Thanks very much. This is just a point of clarification in the report on 6.1. What are the differences between aids to daily living and disabled facilities grant? Is it the actual aids themselves, or is it? It says on 6.1 that aids to daily living, and I wondered whether that was the same as the disabled facilities grant, or whether it was.
I'm not sure is the answer. This is how it's been broken down from finance for me, and that's how we interpreted it, but I couldn't say for sure, but what I can do is confirm.
Yeah, okay, thank you.
Okay. Councillor Colette Thomas, next question, please.
I might have answered this or part of this question. Do we offer any help for children that need specialist equipment, i.e. expensive piece of equipment parents couldn't afford?
We rarely have to. I'm pleased to say we rarely have to, because there is an array of grants and access to funding that is available. You saw the huge list of support. So, for example, I've just seen some information come through of a new large buggy that's been provided by one of our charities that will support a child to be more socially included, because parents can now take them out into the community more safely alongside their younger sibling. So you couldn't put a disabled child alongside another child in a double buggy, because this is a grown child, but they still need that support. We have a single parent who couldn't manage both, so we've made that application for a specialist buggy, and that's just come through, which and now we'll support the parent with accessing community activities, etc., now that she can get out and about.
So we do support if we can't do it ourselves, we do support.
We signpost, that's one of our key features for our care plans and our assessments. We sign, so we don't necessarily wait for that request. When we go out to make our assessments, we'll look at where we can improve the quality of life of these children and these families, and we'll signpost to those services as necessary.
Right. Next question, 27, comes from Councillor Seaborn. Thank you. And this question is, how do we work regionally with partners such as Health Board to coordinate the delivery of services for disabled children?
So all of our children with complex needs, all of our children that are active cases to the Disabled Children's Team will be subject of regular care plan reviews, and those care plan reviews will be multidisciplinary. So we will ensure that health professionals involved with that child either attend or provide information to inform that planning. For our children with more complex needs, so we have had a number of children, as you know, that were in OWR placements. Those meetings are then held far more regularly, so sometimes weekly, sometimes fortnightly. However, often is required to ensure that we have that multidisciplinary team around the child, ensuring that they're safe and their needs are being met effectively. So we also have complex case panel that Jacqueline chairs, which is a monthly panel where our health colleagues and a number of other colleagues from different disciplines will sit alongside us, and we'll talk about our children with more complex needs. So where possible, we ensure that we've got that multidisciplinary approach across disabled children, but also across the whole department. We have procedures in place that ensure that we're working collaboratively.
Also, from a strategic perspective, obviously, we've got the Children and Young People's Partnership Board that sits under the Regional Partnership Board as well, and that's obviously represented by all of the heads of service and senior colleagues within health.
You've already asked question 27, 28 in an earlier comment, so we go on to question 29, which comes from Councillor Seaborn, please.
Thanks very much. This refers to Appendix 2, and Appendix 2 sets out the feedback from the survey. How will we use the feedback and comments from parents and children to develop our services in the future?
In respect of strengths-based practice and collaborative communication, this is exactly what we need. We need to hear the voices of children and parents in understanding that the services we're providing is what they need and what they want. So I would hope to see a lot of this feedback or a lot of that information within children's care files anyway, around that information that's discussed during visits. But this specific feedback, myself and the team manager, it's fairly recent, so it's just come through prior to scrutiny, but myself and the team manager plan to sit together and look at that to see whether there is anything specific there that we might need to make amendments, or we might need to raise further, or seek further clarification around, you know, how we can address anything that's been brought up. Or congratulate staff and services where, you know, we're being told that a good job's been done.
That point was, you know, how do we take it forward? We've got that information, so how do we improve?
And Lucy, do you have your hand up? I know Jane did. Oh, Jane.
It tells us in Appendix 1 that you had 6 parents respond and 1 young person. I wondered how many were actually sent out. I didn't see the figures in there for how many of the surveys were sent out. We know we've had six families, or 6 parents responded and 1 young person, but it doesn't say how many were sent out. Thank you.
We come to our last 2 questions, which again come from Councillor Watkins. So, Jane.
Yes, some parents commented that they've been unable to access support until they'd reached a point of crisis. So is that what's happening in the current system, and how can it be changed so that parents and families don't reach a point of crisis before they get intervention?
I think, obviously, from my perspective, it's really disappointing to hear that. And I think, as Claire has said, in those discussions between Claire and the team manager, we need to unpick and understand why that's happened. And I would link that back to the point that I made right at the beginning of the meeting in terms of the referral sources. And I was quite surprised from a disabled children's team perspective that we aren't seeing higher numbers of families themselves seeking support, and I wonder what that's about. Is that about the stigma attached to children's social services and not understanding the positive support that can be accessed via that route? So is it about families trying other avenues before they come to us, or are they coming to us and not getting the support that they want? So I think there needs to be a piece of work to unpick and understand why that's happened.
Because if there's a gap in what's coming information, at least you'll be able to address it, hopefully, to prevent issues like this or comments like this, which on the whole are generally very good, isn't it?
I would have thought as well that by that active promotion of the register, that might go towards some way of sort of bridging that gap, or sort of hopefully preventing that sort of thing happening.
I think in respect of, you see the criteria for access that's included in the report. The criteria is quite strict in respect of access for services. I think from my perspective, I would be very keen to ensure that those children who don't reach that criteria are supported with lower level services and preventive services. So it might be that we look at the current referral system and ensure that, rather than, and I'm making an assumption here because I haven't looked at it in detail yet, but ensuring that for those families who don't reach that point of access criteria, that we are actually signposting them to alternative services. I would hope that that's the case, but it's something that I'd like to look at and ensure that that's happening.
Just a point, being a grandparent of a disabled child, sometimes their head is down, they're doing the day job, and they don't think of asking for help or even looking for help. So, you know, if that is available to read or a part of the register process, then, you know, that's certainly going to help them. Very often it's only crisis when they come to us, isn't it? You know.
Okay. Last question, Jane.
So just a quick comment on that question, on what you said about the families being, I think one of the families in the survey did say that they were reluctant to engage with a social worker because of their perception of that, but once they had one, they were very happy to work with them. So yeah, there might be a bit of work on that. Yeah, the last question, again from Appendix 2, with regards to the child's response regarding their needs or wants, how regularly are they spoken to with a review of their circumstances?
That would be dependent on their care plan and the requirements. So statutory requirements would be our visiting requirements, our social worker visiting requirements, where the child's needs are considered at least 6 weekly for a child looked after. If it's a child on the Child Protection Register, that would be at least fortnightly or at least every 10 working days. For children who are subject of our care and support reviews, that would be less. But each care plan should be specific to that individual child around that level, the level of need, the level of intervention, and we'd be working again alongside our colleagues in education and health then to understand that level of need, so we ensure that the intervention is proportionate. Some children likes to see their social worker often, others don't. So it needs to be on an individual basis. But we would be sure, you know, all of our documentation ensures that the child's voice is heard and that their wishes and feelings are sought with every intervention that happens. So it varies is the short answer.
No, and that's all good to hear, and just as we would hope it would be. But the young person that responded said that their All About Me documentation was years out of date. So, yeah, maybe they didn't feel what the paperwork they saw was being updated.
So the All About Me document is that document that we use to look for foster placements or residential placements. So that wouldn't necessarily be updated until we're at a point of looking for an alternative provision. The child's care file and the care plan should reflect the child's needs, the child's development, but we wouldn't necessarily be updating those documents until necessary. So that might be about explaining to the child the purpose of those documents and why perhaps that document may be slightly outdated because it might have been written 2 years ago because you've been in a stable placement up until that point. But it might be that, you know, I'm referring to the All About Me document as it's titled, but the child may be referring to something else. So I think, because I wouldn't expect them to have access to that document as a general rule of thumb. So I think I'd like to know a little bit more about that comment and understand what was meant by it to ensure that our systems are effective in being updated, etc.
You would pleased to know that finishes our questioning. Obviously, you're probably dying to go off and have a cup of coffee, but before you do, would you like to have make any summary comments before you leave?
Not necessarily a summary, but just to say really genuinely welcome the questions. I think it really opens up different avenues for us in terms of our thinking. I think sometimes we can think in a particular way and members asking questions really leads you to look at things differently. So I'm hoping that you'll come up with some good recommendations for us that we can consider as part of our planning to take things forward.
I'm sure we will.
Just to say what Jacqueline, reiterate what Jacqueline said, we don't know what we don't know. So if some of the questions that you've asked and I've said, oh, I don't know, but actually I'd be really interested to find out. So yeah, thank you very much for that.
But thank you both for attending. If you're free to now, go and have your cup of coffee. We'll make our recommendations. Thank you both very much, and thanks to the departments for all the work you do.
Thank you. Keep up the good work.
Thanks for all the questions. I think it was a really positive. You seem to want to? Okay. Can we hold? I'm going to put hold for a few minutes for a quick refreshment break. Formal proceedings and is still being webcast. Can I refer you now to the scrutiny activity and invite you to offer your recommendations? So I'm going to hand you over to Rebecca to move forward.
Thank you, Chair. So if I can just remind members of the scrutiny activity for the report that you've just considered. The Children and Families Overview and Scrutiny Committee is invited to review the information contained within the report and firstly to determine whether you are satisfied that the Council is fulfilling its duty to provide adequate and suitable service provision for disabled children. Members, do you have any comments on that specific?
I think we are doing our very best with the number of people that are referrals that are coming forward, but leading to reports and listening to officers, I think there is room for improvement, and I'm sure our recommendations will relate this to the relevant officers.
Thank you, Chair. So if I bring in the second point then, it's to assess whether the actions proposed to develop services provision will improve the offer to disabled children and their families. So I don't know if at that point you'd like to start making recommendations in terms of what the current provision is, Chair?
I'd really like to recommend, and I'm sure I'll be echoed by the other members, about the importance of the register for disabled children, because without that, families will not know what they're entitled to, how they can move forward for grants. And I think that's really a recommendation that officers really push this forward and encourage families to participate. Yeah. Colette, did you come in?
Then carers' ID cards, how we can encourage schools to make sure that schools take that up as well. Yeah.
Jane?
Yeah, so going on from the recommendation that you were making, you're completely right, but I think also the flip side of that is it will help the local authority, yeah. So it's sort of a double win if they can get that going, definitely.
I was helping that lady, and now I messed it up myself. Yeah, it was the bite-sized training that I asked about, and then Rose came up with a good idea about it perhaps being tagged on to governors. So I'm just wondering if maybe we could recommend that.
Got one about the disabled facilities grant. I think we should look to improving the 4 to 6 month waiting list. And if it is a separate pot, then maybe our disabled children's team can make it move a little bit faster. If it's a general pot, it might be that because it's in a list of adults as well as children. So some information on that and recommendation on that would be good.
We listen to officers saying that when disabled children with special needs, they happen to wait for assessments, from the health, etc. How are we going to plug that gap? Although the children will not be in disadvantage, they are in some ways because the grants and the assessment of eligibility from the health board, that really is a concern. And how can we ensure that that gap is narrowed?
So, Chair, if I can just come in quickly, that's posed more as a question. So how would you like to reframe that in terms of a recommendation? Perhaps the exec member representation
of the health board in suitable format.
On my point about the DFGs, on question 19, they did say there was a low usage as well. So, part of that low usage of the disabled facility grant could be combined with whether or not there's a joint pot or not.
Yeah, I wasn't sure. Sorry, I wasn't sure. I sort of got the impression when she said there's low usage, if she was suggesting that's because that's all the need is, or if it was just a fact that she threw out. Or generally, I wasn't quite sure what she meant by that, because first of all, I thought, oh, that's not too bad. And then I thought, no, that's not what she's telling us, but I wasn't really sure what she was telling us.
I think she said she was, sorry, Chair, I think she said she was surprised at the low usage of disabled facilities.
Right, so she was implying that perhaps more people who should be taken
That's what I say, are people unaware that that facility is available, so we need to make that. So do you want to make that into a recommendation? Lucy.
I was wondering, I was looking at the question around this new post of the transition worker. And because I noticed that she was saying it's in its early days, and it would be, I don't know whether this can be made into a recommendation, but to focus on that after a certain length of time to see how effective that is.
Rather than a recommendation, I'll pop that in the comments that the committee would like an update.
Right, okay.
Okay.
Yeah. I think there's also a question on page 23, which is the timeliness of the continuing care. Having to claim back the money. Yeah. Because, that child could have passed away by then, and then they're going back looking for people's continuing care funding.
Yeah, I think it's pleasing to note that there's no gap in that, although we do give a service, provide service for the child. In the meantime, we'll be waiting for health, but health needs to speed up their assessment.
It could be stopping another child.
If that was going to be made into a recommendation, would it be, who would be the exec member that would, whose portfolio on the executive committee would that fall under, that kind of...
Councillor Clark for this committee.
Right, because I'm just wondering if it would be worth sort of wording the recommendation to say if the executive member could look at that blockage.
That's what Councillor Jones would raise about
I've got
commit to
two years as well, so
the suitable forum to raise that as a concern and issue for the committee.
If it's a regional post, then other regions might be having the same issue.
Take on more. I mean, the recruitment is a concern of social workers. What are we doing to recruit? Because Jackie said that most of the new social workers are young and inexperienced. How does that reflect on families with specific needs? Because they really want skilled people working with them. And I know we have to have training, but how are we going to continue to try to recruit qualified social workers? Dave.
Thanks, Chair. I was concerned about the one question that Councillor Watkins raised about the parents not being able to access support until a crisis. So I was just wondering, because they seem quite concerned about that as well, so I'm just wondering whether we can either come up with something that to help them with that, or whether we just make a comment.
They were looking into the referral system, weren't they?
Yeah, but you could recommend it as a priority
Yeah,
area.
yeah,
as
I
well.
think we should do that.
Review.
Yeah, yeah.
Anybody else wants to meet on any more questions? Just like the time before we forget when we go home. There was one, and I'm not sure if this is a comment, Bex, is you said about the continual lead, and how the social workers leave, and obviously they're fully skilled, but with having to give notice of 3 months, how is that assessment and training given on to a newly qualified social worker, or someone's going to take over that caseload?
So I think that's more of a question, Jen. I think she
She
did
did answer it, but it just might be a,
That's what meant that in the comment section.
comment, yeah. Anybody else have any questions?
One
Bex, do you
more,
want to come in?
Chair, and it relates to the recommendation that Councillor Thomas raised with regards to young carers as well, and they mentioned about raising at the youth forum. So being involved in that avenue, because I know that's where the initial concerns that the committee are aware of were raised as well. So I think that would be
I think that would be good. Okay.
There was just one point about they're using the bursary for 2 social workers per year, but the interest was very high. I just wonder whether or not there's a recommendation there to look at whether or not we could afford another placement, another bursary, or to look at, bringing that interest down to get them qualified.
Bex, recommended at the moment.
Thank you, Chair. So there's the recommendation with regard to prioritising, pushing the register and getting the awareness out of registrations on that. There's a recommendation to do with young carers and ID cards, tying in with education, and also tying in then that issue with the youth forum, and then working closely with those. There was the recommendation about the bite-sized training, and obviously the ability of taking that into schools, specifically around governors as well. Prioritising the reduction in DFG wait times. And then there was a continuing care recommendation, and the exec member taking that out with the suitable forums on a regional basis, and then prioritising the issue around the feedback from the survey and unpicking why that gets to crisis.
Okay.
If I can just...
There was a couple of more information needed.
Yes, I was just going to run through, there's a couple of points then for the action sheet, Chair, so if I just run through those with you. So the first one I had was the numbers, the take-up of the provision for young carers. Councillor Seaborn, you asked about that. She said she'd get the numbers of those for you. Councillor Watkins, I believe you asked a question about transport and the minimum age as well, and she said she'd get back on that one. There was the query about the funding, the DFGs, Councillor Seaborn, as you raised. Also one about occupational therapy wait times that Councillor Thomas raised. And I think
The early years services.
it was the early years, yeah. Also the distinction between aids of living and DFGs, or whether that is just how finance categorise it. And there was she said they'd get back to you about the number of forms that were sent out. Councillor Watkins asked about the number of surveys that were sent out. So those will all be included in the action sheet.
Sorry, I was trying to follow you.
I'm sorry.
I was trying to follow you then. Did you say about the Henny Park charity?
Sorry, yeah, and if I wanted to cover that now,
And and did you say about CAMS? So she said she'd find out what the waiting list is.
About CAMS,
Yeah, your CAMS. Okay.
Was there something around? Sorry, was there something around they did say about the form being rebuilt, and to monitor that?
Yeah, easy to read, wasn't it?
Because I asked whether carers were involved in putting that form. Yeah, that was on 4 points. Yeah.
more easily to read for families, and especially with those who may have learning difficulties, because some parents have learning difficulties as well, so they mightn't understand what they're trying to do. So it's important that they learn about it as well.
Did you say about the disabled facilities grant? Because Rose asked, is it combined adult children's? Yeah. And is it all allocated at the end of the year? Yeah.
Will you all, any more recommendations now before we close up? Okay. Right. We now go on to item 7 of the agenda and the items for our next meeting. So can you just remind us, please?
Thank you, Chair. So this is the report where as a committee you consider which item you'd like to scrutinise at your next meeting. You will see from the appendix to the report that you have the basket of items that you selected at the visioning session back in July. There are currently no upcoming decisions from the exec member with relevance to this specific committee at this time, and there have been no recent audit referrals or external referrals at this time. So as it stands, the basket of items that you selected Youth Offending Service for the meeting on the 27th of November. So are the committee still happy that that's the item that you look at?
Yes.
So that will be considering what impact our Youth Offending Service is having in ensuring that preventative activities are targeting ASD hotspot areas.
That's a referral service, isn't it?
Yes. Yeah.
Can we involve representatives from the youth service as well to help us with that?
Yeah.
To see what role they
Yeah.
our youth service, what they're doing and what their role is.
We'll go through, and if anybody has any particular thoughts that they may want to invite, we'll obviously go through them when you have our pre-agenda, and who we want to invite or who we want to have reports from. Is that okay? Okay. So, just to remind you all, the date of the next meeting is November the 27th. Gosh.
A month before Christmas.
A month before Christmas, yeah. So, thank you all for attending this morning's meeting, for your in-depth questioning, and obviously for everyone's contributions. So before I close, just enjoy your afternoon and see you before the 27th of November. Meeting closed.